Continuing our special on heart and health, and with us, no stranger to the show. Last time we had him on was a while ago. I was glad to have him back again. This is Dr. Behrouz Farahmandpour. Thank you so much
Hello.
for coming on the show again.
Thank you.
We do appreciate it. Cold and flu season, fall and winter coming up. Biggest question we got is it the cold, is it COVID, or is it the flu, or now we have the new RSV?
So to start, it could be any one of those. Common cold, I think most people know, is basically you get a cold, you get a little runny nose, you feel a little body ache, but you feel like it's going away as soon as it starts. You take some over-the-counter meds and get a good rest, and you can beat it. With the flu or COVID, it's really hard to tell in the beginning, the first day. It starts out mild, like a cold, but then it'll start to hit you. You'll start to get a sore throat, a headache, sometimes a little bit of nausea. You'll start to feel the joint pains, the flu-like symptoms as they call it. And then it'll start to hit you. You feel like you can't move. There's slight differences between RSV, flu, or COVID, but they're all serious. And that's why with proper testing, that's the thing to find out. With the rapid COVID tests now that are available, that's one way to tell. You go to the doctor or urgent care and they do the tests, but sometimes it comes down to clinical symptoms and how the patient is doing. And you also have to consider what other comorbidities they have. Do they have heart disease? Do they have lung disease? Keeping all these factors in mind. So while most people who are otherwise healthy can fight it on their own at home, it is always best to consult with your doctor and see and get tested to see what else they can do. Don't just assume that there's nothing that can be done, because every treatment is different depending on the seriousness of the disease and your health condition, your age, and other factors.
Now, here at Heart and Health, you specialize in diabetic treatment also. Now, people who have had diabetes who get the flu or RSV, it's much more dangerous for them, isn't it?
Not only with diabetes, but like I said, anybody with diabetes, lung disease, asthma, COPD, you got heart disease, hypertension, anybody with other immunological factor diseases like rheumatoid arthritis, those all are concerning. So again, over here, we do handle all of it. We have different tests. We can test for the RSV, we can test, we can test for the flu, the COVID. Hopefully soon they'll be coming with an RSV test, and right now even there's vaccines for all of them, for the flu, RSV, and COVID, which is recommended based on history.
Now, my next question was, who should be getting the flu shot and who should be getting the RSV shot? Are there any particular groups that are...
Like, it goes back to that same people with the history. Anybody who's got heart history, anybody who's got lung disease, those people are more prone to end up being sick faster or end up in the hospital with RSV, flu, or COVID. So those are the ones that are highly recommended. But not to sound like a commercial, you always have to check with your doctor because of special circumstances. This is not a one-box-fits-all category. You have to look at all the circumstances when deciding when to get it and who should get it.
Now, some people may actually have a sensitivity, they were saying, to RSV and to, more prone to get the flu, or maybe aren't immune compromised.
Some people are more immunocompromised, but also it determines your immune system. Did you have a recent cold? Are you stressed? Are you going through a major complication in life? Other factors like the weather, stress levels, these all affect your immune system. So based on that, it depends on when to get it and who. I always tell everybody you should never get any vaccine if you have a fever, or if you don't feel 100%, then wait a little bit, because if you get the vaccine and you're not at your best, then your immune system can be compromised, and you might even come down with what you think are the symptoms, which is just your body reacting to it, but it might not be that.
Yeah, because some people have reactions to the flu shots and some of the other shots that are up there.
Right, and they might assume that it's from the vaccine, but it could be just their body fighting something in the meantime. So
just basically a reaction that the body is giving to the vaccine, and your immune
Correct.
system sharpening itself up, like you always say, right?
Absolutely. Yes, you're getting it tuned up for the big fight.
There you go. Now, the other thing, we have spoken about this before, but I do have to bring it up because we do get viewer mail about it. A lot of people say that, you know, my family thinks I'm nuts, but I can tell when it's gonna rain, and the weather, especially around the winter time, it's affected me.
Okay, so it's not
True or
just the
false?
winter time. The weather will affect us in a lot of different ways. Whenever it's a low pressure system, like when it's gonna rain, one of two things will happen. The blood pressure, again, it's pressure, so it will simultaneously go down. So that can affect your mood, it can affect how you feel for the day. Some people need to have a little bit more energy drinks just to get themselves going. Also, with the weather, anybody who's had arthritis will tell you that a storm is coming and the degree to which the storm is coming. So these are factors that we know affect the body, yet we haven't discovered the direct connection of how it affects the body. But certainly, weather is a large factor in how we do things. Some people even say how we decide things, it can be based on the weather. Though it's hard to prove in scientific terms, but we know it's out there, and we've had a lot of stories that validate this throughout the years. With that being said, you still need to go see your doctor to get a preventative checkup once a year. You should be up to date with your vaccines. And some people feel that maybe they might be lacking vitamins. So some of the vitamins we recommend that you should be taking daily is a multivitamin. If you don't want to do a multivitamin, there should definitely be vitamin C. That helps with the immune system and with healing and repair. Vitamin B certainly deals with avoiding depression and boosting energy. Vitamin D has a lot of good factors. Besides calcium absorption, it helps regulate skin function, and it also acts as a hormone in the brain, as a regulatory system, helps improve the brain function. So there are different ways in which we can boost our immune system to help deal with whether it's a weather condition, stress factors, or other things.
So your doctor could pretty much tell through tests if you vitamin C deficiency or vitamin D sufficiency.
Absolutely, we can tell. But sometimes, even without doing the lab tests, some people will just naturally feel better just taking the vitamins. It might be subtle changes, because the blood test doesn't always pick up exactly, what's wrong. It could be that you're in a normal range, but you just need a little extra boost to get you past that, because some people will be in the normal range but still need extra to feel better. So not always a test will determine it, but that's one of the things here in Heart and Health that I love working here. We always sit down and look at the whole picture. We don't just make a judgment call, oh, this is this. We sit down, we try to explain to our patients what's going on, and if we can't figure it out, we have a multi-specialty practice.
Right.
So we have heart doctors here, we have an asthma and allergy specialty, we have podiatry, and physical therapy, and we also have osteopathic manipulation. So
Right.
we use different modalities to try to figure out the different problems and help the patient in an overall comprehensive manner without making them suffer to go to multiple places to get the job done.
How does that usually work? I know it's not a massage, it's like a special manipulation or something.
So the term is called osteopathic manipulative treatment. We are board certified. We go to a school known under Doctor of Osteopathy, that's our license. And I myself, I'm board certified in family practice and osteopathic manipulative treatment. It's a hands-on technique in which we learn to help the body balance itself, heal itself. And when the disease process starts or when pain starts, we use different modalities, including soft tissue techniques, adjustment techniques, as well as soft tissue balancing techniques that help regulate the body. Specifically, it helps to improve the blood flow, it helps to relax the muscles, the ligaments, the tendons. It helps to reset the nervous system to become more proper functioning, because sometimes the body just needs a little bit of a reset to get itself going. And depending on the problem, that's what we do. And one of the other philosophies it has is that sometimes people think that problem is only in one spot, but according to osteopathic philosophy, the body is connected everywhere. So one part of the body can affect another. And we try to keep that in mind and figure out where the origin of the problem is and not just go where the pain is. Because when I first started, I would go after the pain and I only had a 5–10% success treatment. When I started applying the osteopathic philosophy in its entirety, I started to get treatments that were 80–90% effective, and I still do till today.
And OMT, if I may,
Yes.
it's not a pain-causing thing. It's something that's going to actually relieve that pain. And a lot of people, they make it up off the table and they're a little, but then as soon as they start getting up, walk around, they're like, hey, it's not.
So the old philosophy is anything can get worse before it gets better.
Right.
But for the most part, sometimes the body takes time to heal itself. It can take up to 72 hours after treatment.
Right.
And what happens is people panic, oh, I got pain, it must be getting worse. No, what happens is sometimes you're just releasing the pain out and it just kind of needs to make its last stand, so to say, before it leaves. Right. And we do inform patients that, if this happens, don't panic, just relax, let it pass, and you will start to feel better.
Exactly, and by no means go do a workout or anything else.
No,
like that.
you gotta use common sense. I depend on common sense with my patients, Use common sense, balance it, don't rush into it, and take it easy, and eventually we'll get to the problem. And nothing is better than knowing that you get a patient that could barely move, and within a few weeks, they're moving around, and believe it or not, sometimes they don't even realize, but their problem was from 10 years ago. The pain never fully healed. Exactly. And the current problem has to do with the old problem, and you fix both, and they're like, wow, I didn't even know that I had that till you told me.
Yeah, and OMT is it's almost like a medical science, the way it's, I know with the training that you
there's definitely science behind it. There's been testing done, there's been experiments done. So this has been around for over 100 years. The old story that we have is that the patients who went to see osteopaths during the flu pandemic actually survived. They had a greater chance just because their immune system was functioning better at that time and they were able to,
So the OMT can actually help your immune system?
The OMT can help with it. Cardiac, lungs, immune system, muscle. It's not just for pain and muscle system only. It helps overall with everything. And what's beautiful is when we started, we also have physical therapy that keeps it going. So it's a nice little full circle where you get the healing process with different modalities that help it get better.
And well, one of the things we were just talking about was that how, like here at Heart and Health, we look at the whole entire car, which is the whole body.
Correct.
And OMT, I guess, would be the wheel alignment, because your car's not driving, it's pulling over to
No, you can't assume it's a wheel alignment because wheels are just one part of the body. We look at the entire. We look at the doors, the hood, the trunk, so to say, to the analogy.
So it could be a hinge on the door, it could also be out of alignment, it could also be a muffler.
Actually, I'm glad you brought up the car analogy because, for example, there's two parts that I'm going to use as this. One, people come and ask me, well, how can you tell with just touching one part something's wrong? And I tell them, how do you know what's on the road through the steering wheel when you're not touching the road, but you feel it through the steering wheel?
Right.
We are able to feel through the body parts what's going on in different parts just from pressure and movement. So that's one example. And then you have the other example. Well, if you get a tire that's imbalanced on one side, doesn't it affect the whole car?
Right.
Exactly. So when you have something in the body that's not working properly, it's going to affect multiple systems. And so you have to look at the whole picture and know, it's not just one part that you're going to fix, because then the problem's going to reoccur again. You got to fix the whole thing.
Right. And we know that, this is, here at Heart and Health, it's individualized, personalized medicine. With the OMT, what is like the most common area you're going to see? Is it the neck? Is it the back, the shoulders?
Most common area I see is anywhere along the spine. Basically, it could be neck, back, shoulders. I've learned when patients come in and they say, I have neck pain, I automatically assume, and when I examine, they end up having upper back and lower back pain. Because the reality is that the body is under stress and it hasn't been treated in a while, so the stress continues to build up. And so it becomes all the muscles across the neck and lower back and upper back that are affected. But it's not just that. We also look at to see what the problem is, and we work together, all the specialists. Like when I can't figure something out, if it's a diabetic problem, I'll send it to our endocrinologist.
Right.
If it's a foot problem, I'll go to the podiatrist. If it's allergy or lung related, I'll send it to our allergist.
Right.
And of course, everything is heart related.
Yes.
That's why our logo is heart and health, because we know it's where it starts and where it ends. So we always do a complete heart checkup for everybody, knowing that that could be part of the bigger picture. So we try to encompass it all. And of course, anytime we get them to physical therapy, get them to know. And most people think physical therapy is you have to wait till you become bad, but no.
Right.
Or osteopathic manipulative treatment. We can tune you up even when you're at your best. We get you to a point where you don't reach that point where you become debilitated
We
and
can
can't
stop it
work.
before it starts.
Yes, and that's the best part of the preventative care that we give here.
And one of the things you were saying about the OMT, about everything being connected, how that stress in the neck can move itself down further, spread to the shoulders, and because everything is connected.
Yes.
So it's like having the tension on the wire, and then you're pulling it, and the strand just
It keeps pulling like
Exactly.
more ropes.
Right.
Exactly, that's perfectly said.
So this way, when you get a patient in here and do that, the OMT is for everybody. It's not just limited to,
No.
one age group or anything like that.
No, I've treated anywhere from young children all the way up to 90-year-olds and everything in between. Whether they had just a minor problem, whether just had today, as a matter of fact, a gentleman came and said, I had right ankle pain, but if you didn't treat my back and my right hip, my ankle wouldn't have got better. And he could have gone to physical therapy all he wanted, but that's what helps, that's the connection. Or I have another patient today that was working with physical therapy, but she had such chronic problems that it might be bigger, and I'm sending her to the other specialists to get a complete workup done. So we have to be aware that it's entire medicine. It's not just look at just this and that's the problem.
Right. And like you said, the whole car. Right.
Whole car, as you said. Exactly.
Now,
Exactly.
I should have had the intro. Your background at Heart Health, you've had, now we know from having you on the show last time, which was like 10, 12 years ago, but you've had a lot more experience and a lot more.
Oh, since then, I think I've grown a lot.
So
I graduated in 2005, board certified in family medicine and osteopathic treatment. I joined Heart and Health in 2011, and since then I've been the medical director of Heart and Health in Coram. And we try to tackle all the experiences. What I love about Heart and Health is that I've grown to know a wide variety of patients, and they all keep coming back. They know the care they get here, they know the service we provide. We put our heart and soul into treating every patient. We try not to turn anybody away, and we make sure that we follow through with as much of their problems and making sure till they find a resolution. We don't, it's not a cookie cutter box where you go in, oh, here's your meds, have a nice day. We definitely try to listen to the patients, see what their problem is, and making sure that they are attended to effectively.
Right. And not factory medicine like we've been saying before.
No,
individualized, personalized.
This is not,
towards the individual.
right, we are not taken over by any hospital. We work independently. We have multi-practice specialty, not only in Coram, but we have it in North Babylon, we have it in Massapequa, Plainview, and our newest in Levittown. And we keep expanding.
Right.
And we provide the same level of service of care, even though we're expanding at every turn.
Right.
because we work hard to make sure that everybody who works in heart and health fits that criteria.
Right. And we have a great staff here.
Oh, the staff is amazing in all our offices.
Yeah.
Yes.
And, you know, it's not like you're gonna be, you know, what they call the factory medicine, come in, take your number, have a seat, see the doctor, then you're seeing a different doctor next time you come by and everything. You know, you have your patients, they're your patients, you see them, and when there's an issue, you get to send them to another doctor that's usually right here.
Correct.
So it's like one-stop shopping.
Absolutely, and that's what we're trying to make it, and we're still continuing to grow. And I gotta tell you, with all the years that I've been here, the group keeps growing and keeps getting better and better. It's just the way medicine should be practiced. And I hate to say this, but when you ask people outside how medicine is doing, it's going the wrong way.
Right.
And luckily, at least right over here, we know we're doing the best for our patients, and we're not looking, you know, at the bottom line, it's all about money, it's all about money. We are taking care of our patients the best way they need to be taken care of.
And going back again, when we had you on the show back in 2011, you know, the medical advances that, you know, have had during these past, you know, 11, 12 years, you're constantly learning and training and catching up on things. I know this, you know, you never have a spare moment, you know, you're always like
to keep busy.
Yeah,
it's a family trait.
Exactly. So, you know, it's, you know, the AMA journals and this new medicine where, you know, a lot of times I've talked to the doctors here at Heart and Health, like, did you hear about this? And you guys will be like, yeah, it's interesting. Or, no, I don't think so, you know, which is really good because
we try to keep up. So far, the advances have been in a lot of fields. I mean, the first thing I think of is cancer advancements that have gone on, and basically people are living longer these days. You can use the word cancer without meaning death sentence. I don't want to say it, but yes. And right now the advances in respiratory, in diabetes, in cardiac techniques, weight loss, I mean, it keeps growing and growing. But we also have to keep in mind, just because it's there doesn't mean we jump into it.
Right.
We make sure that it's safe for the patients. We got to do it the correct way. We want to make sure that we are following the standard of care without compromising the patient's health. And we always make sure that they're attended to make sure there's very few side effects. And to this day, it still amazes me how some patients, when I say this medication is not meant for you, it's got side effects. No, doc, I'll take it. I'm like, no, there's other medicines we have.
Right.
Like it's they feel like just because we gave it, that means that's it. No.
But also, you know, a lot of the hype from these drug companies, you know, the way they sell it, you know, on TV, which really cracks me up. It's like, hey, it'll cure this because it may cause death.
Yeah,
you know,
no.
I mean.
And that's why, I mean, not to sound redundant, but when patients come in and they start using Dr. Google on us,
Yeah.
I'm sorry, if Dr. Google went to medical school, then Dr. Google can prescribe your prescriptions. No, this is serious. We need to take it seriously. This is, you know, when a patient comes in, I like to use the technique of keeping it light and keeping it relaxed, because I know the patient's stressed as it is while they're sitting in our room. But when it needs to become serious, it becomes serious. I'm not here to joke around with the patient's health.
Right.
We need to make sure. I don't even want my patients to ever end up in a hospital or in a situation. I understand as a doctor and as a human being that can't be prevented, but we do our best to make sure that we keep that to a limited number. And I tell them, whenever you're in a situation where you're not sure, please call. You know, don't hesitate, because if you start, you know, getting advice from family members or friends who are not in the medical field,
Right.
that's when you start to create trouble. And then you just made it 10 times harder.
Oh, I read on the internet that.
Oh, yes,
How
on
many
our
times-
lovely internet.
How many times do you get that? But, you know, the other thing too is follow-ups. And some people are like, well, you know, I saw him and now I'm feeling okay, so I don't have to need a follow-up. How important are these follow-ups?
Follow-ups are important. I won't say every time it's critical, but if we make a follow-up, there's a certain reason. I'm not going to sit there and explain to every patient what the reason is, but I can give you a quick synopsis. when a patient comes in, first, I wanna make sure they're healthy. Second, I wanna make sure that they're taking their medications and nothing has happened to them in the past few, whatever, weeks, months that I've seen them. When certain patients have certain chronic diseases and they're taking medications, we need to follow up to make sure that there's no side effects still, they're taking their meds appropriately, they're not overdoing it, underdoing it, and also to make sure that their blood work is up to date, and their physicals and their preventative care,
Right.
you know, depending on the season, the vaccine, depending on their age, what's preventative at this age. Certain patients at a certain age will need mammography for females, or blood tests for prostate testing. BPH. You have to get your stress test starting at a certain age, or a colonoscopy. These are all different factors that come into play. For example, I'll give you one that I just had recently that keeps coming up, never fails. A diabetic who feels that they understand what diabetes is, and they'll check their sugar at home and it's too high, and they'll take an extra medication which can put them in harm's way. Or their sugar is normal, but they think it's low, oh my god, and they stop their meds, and again they harm themselves. So
Right.
these are the matters that we have to stay on top of. And of course it's never easy, but for the most part, the best patient is the one that's compliant, but also appreciative.
Right.
Then we know they care. And for myself, it's very simple to know when a patient cares, because they come in, they're like, doc, I'm ready. Like they give the all sign, like whatever you say I'm gonna do. And they realize this is about their health, this is about them. We're doing this for them, not for us.
Right.
And that's the most important.
Well, we're basically out of time, but I really did want to thank you because it's been way
Oh,
too
it's
long
been a
since we
pleasure.
had you back
Thank you
on
very
the
much.
show. And we're hoping that it won't be another 10 or 11 years since we get
No,
you
we're
back
gonna
on.
keep this going sooner.
Well, until next time, I'm Larry Mike Arenda. I've been with Heart and Health, and we'll see
Dr.
you right back
Farahmandpour,
here.
thank you.
Take care.
Bye-bye.